I want to thank everybody for coming to our Ask an Accountant presentation this evening, the first of 2024. And we're very happy to welcome David Zetter tonight. David's been a friend and colleague of mine for over a decade. I won't say how much over a decade because that'll tell you how old I am. But we are members and past presidents of the National Society of Certified Healthcare Business Consultants, which is a great organization that provides a lot of quality information for those of us that work with doctors and medical practices. He and his firm have provided practice management consulting services to medical practices, facilities, and organizations for nearly 25 years. He's a nationally recognized management expert and a fabulous speaker. I just saw him speak last week, and his certifications and affiliations are too numerous to mention. Suffice it to say, he's my go-to person when I have a complex medical practice billing or management issue. David, take it away.
Thank you very much, Judy. Pleasure to be here with everyone. So I was asked to do a presentation today, and I'm going to basically, I thought this would be appropriate, an annual checkup, a well visit for your practice, since pretty much every business needs this. So we're going to go through and discuss this today. Some information about me, disclaimer that this is based on my experience and clients that I have and all the information I have. Everything is up to date in this presentation. So let me just kind of review some of the learning objectives that I would expect that you would walk away from this webinar today with. Basically, you guys, all of us tend to schedule periodic physicals for ourselves, for our well-being. The question is, a rhetorical question, is why wouldn't we do this for our businesses? And I'll just let that sit there for a little while. Want you to understand why medical practices necessitate a periodic evaluation, and we'll get into all those details. What areas of the practice should be evaluated? Are there any benchmarks to compare to? How are benchmarks determined? How often is the evaluation to be completed? Do you do it annually? Do you do it monthly? Do you do it every 5 years? Well, that all depends. Who should perform the evaluation? And what should be done with what has been learned from the evaluation? So when we end this presentation, hopefully you'll have answers to all of that. So let's just talk a little bit about general practice questions. How's your practice performance? Do you know? Do you review your financials? Do you review any metrics on a daily, weekly, monthly, quarterly, or annual basis? What do you know are your accomplishments, failures, and lessons that you've learned over the past months, years, whatever the case may be? Because obviously when we make mistakes, we don't want to make those again. So it's obviously very good to understand what our failures are, learn from them so that we don't do them again. Failing is not what we definitely want to do, but failing often is necessary so we learn, because we are never going to learn from our successes. How do you react to changes in the healthcare environment? How does your practice react to it? Are you aware of what those changes are in the region around you and your community environment of healthcare? Do you realize your business is a living organism? It needs to be fed no different than we do. What about growth efforts? What are you doing to grow your practice? Are you just looking to stay stagnant, stay status quo, or do you want to increase revenue and profits and grow the business? What about functional leadership? Or do you have dysfunctional leadership? And is your practice patient-centric? And what I mean by that is everything you do designed to lead to better patient satisfaction, care, the environment, and so on. Patients are your Patients is where you get your revenue. So as long as you're running a business and a practice that is catering to what the patient needs are, you should be successful. So some of the things to think about here: was the practice's performance this past year in 2023 consistent with your vision, your values, your mission, and your strategy? And have you even discussed those four things? What were your accomplishments? What were your failures? And what lessons can be learned from all of that? In your healthcare environment, whether it's local, regionally, or nationally, how are you reacting to all of that? We get changes all the time, every day in healthcare. So what are you doing to adapt to that, to be flexible, and to help your practice grow? As I said, a practice is a living organism. So is it growing or is it dying? You never stay the same. So you really want to set goals so that hopefully you will achieve them. But it all depends on how you built your yellow brick road to lead you to Oz, so to speak. What did we do to grow the practice? Were we successful? So it's kind of like, think about this. If you were going to do advertising, and let's say you were opening up a new practice and you use the radio, you use social media, we used to use newspapers. What of that is working? How do you know whether it's working? Are you tracking it? How did our board function, or how did our leadership function? Did we have participation from our physicians? Did we have providers that weren't very productive? Do we have providers that are cost centers, or do they produce revenue? Did we develop new leadership to ensure succession? Do you guys provide access, better access than your competition to your patients? What about patient satisfaction? How do we know whether we did this or not? If not, why not? And how do we start doing this? So let's talk about some messages. You can't manage what you can't measure. And if you don't measure things, you're not going to be able to manage it. So most businesses have key performance indicators that you can utilize in order to understand how your business is doing. You can't know whether or not you're successful unless success is defined and tracked. Management is doing things right. Leadership is doing the right things. All three quotes from Peter F. Drucker, and I've read plenty of his books in my lifetime. So the reason why practices need an annual evaluation is because you want to know how you did, and don't you want to improve your business? If you don't, then you don't need to do an evaluation. But I would venture to say your practice isn't long to be a going concern if you're not managing it and measuring it. So let's look at the areas of evaluation. First of all, management. Is management sufficient? Does it have oversight? Just because you have managers in place doesn't mean that you just let them go and do what they want. Somebody has to provide oversight, whether it's the owners, whether it's a consultant, whether it's some type of an advisor. Somebody needs to provide oversight, because you don't just let somebody loose and not manage and measure what they're doing and whether it's working. You can't leave management unchecked, because if you do, the war stories I could tell you are numerous. Every practice loses money through revenue cycle. There isn't a practice or a medical business or healthcare business in this country that does not lose money. And the reason I can say that is because I've been doing this almost 25 years now, and there hasn't been a time where I haven't done a revenue cycle assessment and found lost money everywhere. Where are your holes in the dam? Are you plugging those holes? So I just did a presentation today and talked about a leaking sieve, which most medical businesses are. What areas of operations are flourishing and which are floundering? Patients that are happy and can easily communicate with the practice, those are the ones that you want, and that's going to help you build your business. That will help you flourish. How about our staff? How are they performing? Can you identify opportunities for each employee to flourish? What about your succession planning? You may have an administrator, you may have practice leadership in ownership, in owners, but what happens when one of them retire? Who are you grooming to take over? If you've got a large practice, sometimes a lot of what we do is we assign certain responsibilities to each of the board members or board of directors. One will have responsibility for finances, one for HR, one for operations, and so on. If somebody ends up retiring, who has the expertise to manage that and oversee that going forward? There are more laws and regulations today than there ever have been in healthcare, and they keep growing. I mean, heck, we just had transparency and coverage that was passed a couple of years ago. We've got the No Surprises Act. We've got all kinds of things that are happening, including the DOL now is even watching subcontractors more carefully, because you really have to pass the test on whether somebody is an employee or a subcontractor. If you're paying somebody as a subcontractor and they really aren't, you could have some detrimental risks applying to your practice there. Do you have an idea on how old expensive equipment is and when it will need replacing and when you have to paint the building? So you've got issues with your facilities. Are you growing revenue and profits? How do you compare to last year? Do you budget? Do you forecast? Do you predict? Do you know how many patients and revenue you need to pay the bills each week or each month? Do you know what your providers need to produce so that they aren't losing money? Do you know how much it costs you to employ that provider? You got to add up your payroll taxes too, because you're paying for that. So what does it cost you to employ a provider, and what do they need to produce in order to cover your expenses, cover their expenses, and to make the practice profitable? There are so many things to measure in each of these areas that I've listed here. You really need to identify which items are most important for your practice and the owners. In some cases, you may not have an issue with human resources. Maybe you've got the best staff in the world, although you are going to be very lucky if you do, because most businesses nowadays are all looking for employees, especially since COVID. But if you have the best staff in the world, maybe you don't need to be evaluating that on an annual basis. So let's talk about management evaluation. Are the roles and responsibilities defined, communicated, and monitored regularly? I mean, even in management, you should have job descriptions for everybody that everybody signs off on. That way, they promise that they can perform all the duties and responsibilities without accommodation. It's not just okay to just write a job description and not have your employees sign off on them. Otherwise, you have no validity on them stating that they can do it without accommodation. Are the right people in the right positions to lead and manage? Did we perform as a finely tuned orchestra or as a cacophonous garage band? Did we meet our financial goals? Did we have financial goals? I mean, at the beginning of 2024, you should have had a projection for this year. You should have an idea on how much money, profits or losses you should be making each month. Hopefully it's all profits. And whether you're achieving those goals in revenue. Do we have the right staff in the right positions doing the right things? What are the opportunities for improvement here? A lot of people make a lot of mistakes many times when they have staff and they have issues with a staff member, and they just keep giving them additional chances to get it right. Sometimes you need to cut the cord. Did we work to improve our processes and to increase effectiveness and efficiency? Do we have specific processes? So do you have policies and procedures? If you don't, then your processes aren't documented and your staff are going to get trained by anybody. And that means anybody that has a bad habit is going to proliferate those bad habits to others that they train, unless you've got a documented policy and procedure that you can pull out, follow bullet by bullet, and somebody can follow that and never make an error or a mistake. That's how training should be conducted. Have we evaluated the management team and their performance, and has this been communicated to them? I'm a fan of ongoing performance reviews. I'm an HR professional and have been for 40 years. I have never believed in annual reviews. I always believe in constant feedback, whether it's negative or positive. If it's positive, you do it in front of everybody and let the world know about it. If it's negative, you pull them aside privately and you conduct literally a 1-minute counseling session. If you're taking too much longer than that, then you're just browbeating them. And that's not how you manage people. So have we set goals for the upcoming year? We're in the upcoming year. So if we don't have goals, we're already behind the 8 ball. So job descriptions should be communicated and signed for every single position. Even physicians, your NPs, your PAs, if you don't have duties and responsibilities delineated in an employment agreement, which my opinion is no one is on an employment agreement unless they're a billing clinical provider. An office manager should never be on an employment agreement. Otherwise, you lose your at-will employment rights in any at-will state. Unless, of course, you document it properly in that employment agreement. You also, if you're writing offer letters to employees, and let's say you're going to pay somebody a salary, you always want to document it that it is a biweekly salary, not an annual. Because if you have an employment agreement that says an annual salary, you can never terminate that employee until that annual employment agreement has ended at the end of the year. Those are legal issues that can catch you in a bind. You should conduct regular communications when counseling or positive attributions are called for. Obtain 360 feedback from your staff. Everybody thinks it's great to do a review of employees, but they never ask the employees how they think we're doing as management or providers. And those are the people that know best on how you're performing. Your patients can do so as well. That's why every practice should be doing patient SAT surveys. And if you don't, well, the payers know more about your business than you do because they survey all your patients all the time. So they definitely know how your business is doing. Does management support staff and willing to lead by example? If they don't, then that should be changed as well. Part of the job description, their duties and responsibilities. Management should prepare budgets and monitor financial performance, and this should be regularly communicated to owners or the board of directors, either on a monthly basis. I mean, my stance is that the owners or providers, board of directors get a copy of the financials every month. If we have a large enough practice and we're doing board meetings, we review those monthly financials every month with all the owners and the board. Or we do it on a quarterly basis, and on a quarterly basis, we're doing a deeper dive to pretty much identify what we need to change. You want to look at your financials so that you can manage the process and make sure that management is evaluating things properly and making changes that they need to based on what that financial performance is. What about compliance policies, procedures, training, education? Is that all in place? Every medical business out there in this country, if they do any business with Medicare, Medicaid, Medicaid managed care plans, or any Medicare Advantage plan, TRICARE, the VA, any federal or state run mandated health system, you are required to have a documented written compliance plan. If you don't, you are in violation of federal law. And that was all documented in the PPACA laws, which is Obamacare. Are the right management in place to take the practice into the future? If you plan on having a practice that's going to be around for the next 30 or 40 years, what are you doing to make sure it is around for the next 30 or 40 years? Do you provide regular updates and performance review to the owners of the board? Kind of like what I discussed with a practice last week, where the billing department never communicated anything about their accomplishments. They don't communicate KPIs. There is nobody in this practice that I'm referring to that knew anything about how the billing department did, whether they performed their job duties properly, whether they were doing anything other than submitting claims. So if you don't evaluate this, there's no way to tell whether your management are doing their job. And that counts for revenue cycle management as well. So let's talk about revenue cycle evaluation. When was the last time a revenue cycle assessment was completed to determine what monies are being lost? Do you know how many denied claims? Actually, do you know how many zero-based claims that you have in your system? There isn't a time that we do a revenue cycle assessment where we don't find claims that were never paid, never worked, never appealed. And that just tells you that the billing people or department aren't doing their job. Are claims being submitted timely? My recommendation is that notes should be closed every single day before they walk out of the practice. Now, sometimes that's not achievable. So I always require that they're closed within 48 hours. You want those claims out the same week at the latest. But I'd prefer to have claims submitted on a daily basis. Does your billing personnel know ERISA regulations to protect revenue? This is a big one, folks. I'm speaking more on ERISA in the last 3 years than I ever have in my lifetime. ERISA has been around since 1974. It is the 50th anniversary of the ERISA regulations. ERISA is not a healthcare law. It is a labor law. That is why no one knows what the regulations are. But ERISA protects 80% of the claims in this country. Any claim that is sponsored by an employer, and that employer is not a government entity of any type, township, county, state, federal, doesn't matter. Even if you're a Park and Recs employee, you're part of a government employer. Additionally, if you're employed by a religious organization, such as a church, a parochial school, all of those health plans would not be considered ERISA-sponsored health plans. But if you're employed, I'll give you an example. I'm 64 this year. I'm going to turn 65 like one of my friends on this call next year. He ended up going into Medicare this year. I'm going to go in next year. If all of my health plans for all my employees are sponsored and paid for 100% by our business. If I pay for that health plan, since Zetter Healthcare is going to be paying for my Medicare plan, that is an ERISA-sponsored plan because this employer is paying for it. So now Medicare falls under ERISA regulations. The thing is that ERISA prevents any payer on an ERISA claim from taking your money back. So let's give an example here. You've got a claim that's an ERISA claim, and United Healthcare calls you up and says, oh, you overcoded on this. We're either denying this, we're going to downcode it, or we're going to deny it because of medical necessity. Any of these reasons, they cannot do that. It's against federal law. Their contract, United Healthcare's contract, says that you only have 60 days to appeal a claim. Wrong. Federal law allows you 180 days. And there's no contract any commercial payer can write and document that can waive your federal law rights. Yet no one knows this stuff. And the reason the payers get away with it, because nobody holds them accountable. We do this every day. You can send a letter to Department of Labor, copy the EBSA, which is a federal agency that provides oversight. And the minute that CEO of United Healthcare that gets that letter, they will cease and desist. But how many of you have returned a ton of monies to payers over the years? Every dime of that can come back as long as you know how to manage that. So ERISA is a huge, huge management tool. Problem is, less than 2% of healthcare employees in this country know what ERISA means and what it does. And I'll just leave that sitting there for when you want to attend one of my ERISA presentations. Have you evaluated each step of the revenue cycle to determine effectiveness and efficiency? Here's another thing. How many of you have a signed assignment of benefits by every patient? Because if you don't, you have no right to submit a claim and you have no right to collect the money. Every payer, if you don't have that assignment of benefits, a valid, legally drafted ERISA and PPACA assignment of benefits, you can never bill insurance and you can never collect the money. And technically, any payer, when they ask for medical records, they always ask for intake paperwork. And part of that intake paperwork is the AOB, the assignment of benefits. It gives you the right to submit the patient's claim. All claims belong to the patient. All records belong to the patient. Anybody that tells you differently is wrong. Those claims can only be submitted if the patient gives you permission and they've done it in writing. Otherwise, every payer can request every penny back that they've ever paid you. So right now, I've got all kinds of people listening in that are scrambling and scared to death. It's easily resolved. You just have to know how to handle it. Do you have copies of all executed payer contracts and fee schedules? If you don't, how do you know you're in network? And how can anybody run a business when they don't know what they're supposed to be paid? This happens every single time we do a revenue cycle assessment. Nobody has fee schedules. Nobody knows what they're supposed to get paid. So, Cigna pays you $111.23, but their contract says they should have paid you $150. You're not going to know it if you don't have the fee schedule. Payers are required by law to provide those to you, but you need to know how to hold them accountable. 95% of medical businesses in this country don't know their fee schedules, don't have them, and don't even know how to obtain them. Are demographics being collected properly? Do you realize the number one reason why claims are denied is because your front desk or whoever's scheduling patients doesn't collect the proper information? Do you have proactive revenue cycle or delinquent accounts? Proactive revenue cycle does not submit statements to patients. We don't have somebody in the back room calling patients during the day when they're never home trying to collect on their account. That is reactive revenue cycle. That means you're chasing money. Think about it. What business in this country chases money? Only healthcare. Everybody else gets paid for their services, either at the time of service or before they ever get the service. But what do? We collect that checkout. We send them statements. We call patients. It's an effort and futility. It's a waste of time. It's never worked. It's never going to work. Are denials being worked and managed appropriately? What is your first pass rate on your claims? Do you know how many denials you have every week? Do you know who's causing them? Do you know what causes those denials? Why do you still have denials? Because if you get a denial, it should never happen again after you've investigated it and fixed it. Have you analyzed your payer mix and your payer relationships? Do you have a payer you shouldn't even be seeing those patients because they don't pay you anything? You lose money every time a patient walks through the door. Those are things that you need to understand. Have you analyzed your payer mix and your payer relationships? When was the last time you negotiated your contracts? I mean, we just negotiated for a pediatric practice in Montana. We got a 26% increase from one payer, a 27% increase from another payer, a 17% increase from another payer. And today we are, for another practice, an otolaryngology practice, I got a 39% increase. They make over $3 million a year in revenue from this one payer. 39% increase. I'm not saying this can be done with every contract, but if you haven't tried and you don't do it properly, look what you're missing. And contract negotiations is a long, tedious process. You've got to determine leverage, and ERISA provides that leverage to you. You get one claim that wasn't paid properly, the payer is now in violation and breach of their contract. Do you have KPI dashboards to provide quick glimpse of RCM processes? I've got clients with monitors on their walls near the ceiling, and everybody that walks through that revenue cycle process knows what revenue's being documented for the day, the week, the month, how it compared to last year, what all their KPIs are. All of it's up there, literally on monitors, so they can monitor it. And they literally have a bell, no different than bartenders do when somebody gives a tip. When they achieve a goal, everybody in that office can go in and ring that bell. And sometimes it's ringing off the hook, but they have a blast doing it. So additional billing roles and responsibilities should be defined, monitored, and communicated. Your billing should be supplying management and owners with KPI dashboard to provide proof of effectiveness and accuracy of the processes. And then maintain a payer book. Years ago, everybody used to have binders that had all the medical policies, LCDs, NCDs, all this kind of stuff for each payer. That way you knew exactly what you needed to do, how to submit claims, whether somebody came in for a service, whether it required a prior auth. Oh, by the way, ERISA tells you what prior auths are needed. Actually, the patient's policy dictates what prior auths are needed. The payer can never dictate what prior auths are needed. So all those prior auths that all of us are jumping hoops through, half of them aren't even valid. And you can stop them in a heartbeat if you have the patient's healthcare policy. And that's a whole different presentation. Annually identify roadblocks and walls erected that prevent processes from being efficient and implement and execute solutions. That's kind of talking about Lean Six Sigma. All you're doing is getting rid of all the inefficiencies and putting in processes and systems in place to make it more effective. You should be conducting a full revenue cycle management assessment every other year at a minimum, and a third-party analysis every 3 years if you're completing the RCM assessment internally. That way you get somebody outside that is a revenue cycle expert to give you a third eye on everything to make sure you're monitoring and tracking it correctly. What about compliance with all federal, state, and payer requirements? Those need to be monitored, because if you're not doing it properly, you risk having to return money. Regularly evaluate services, contracts, reimbursement rates to determine potential revenue opportunities. I mean, if you don't have your fee schedules, how do you know whether you're being paid properly? And then how do you know whether you need to raise your fees? Are you looking at the claims being paid, and is 100% of your fee being paid, or whatever your charge is? Let's talk about operations. Do we have operational policies and procedures that prevent mistakes and bad habits? My old life career was in food service. I ran hundreds and hundreds of restaurants, and every single one of them had the same operational policy and procedure, because that was the only way we guaranteed that if you went into one restaurant and then went into another, the customer is going to get the same experience. You go to a McDonald's in China or Russia or the US or even Timbuktu, that cheeseburger tastes the same no matter where you go. That's because they require purchasing the same product, and everything's documented on how they make it. How is patient flow? Are there any roadblocks to providing services efficiently? Do we have the right and enough staff to provide the level of service that we intend to? Are our providers meeting productivity levels? Do you do a productivity income split every single quarter to find out whether your providers are creating revenue or generating losses? Are your employees happy, and do we regularly communicate our concerns and positive feedback? Are we missing any ancillary services that would complement the practice and provide convenience to our patients? Even if all you were doing was dispensing some regular vitamins and maybe some medications, it makes it more convenient for the patient than going down the street to the pharmacy. Define the metrics you will measure on a daily, weekly, monthly, and annual basis to determine how the practice is doing. This is a big one. You've got to have metrics. You have to have KPIs. If you don't identify those, there's no way you can track how the practice is doing. You can do it with financials, but you're not going to see the other areas that you can manage and measure. Keep an eye on news from trusted sources that are relevant to your practice, especially if it could affect your day-to-day operations. Keep an eye on what's going on in the community, in the healthcare environment, at the local health systems. How are those changing? At competitors. Are you providing optimum services? Can you adjust your offerings to improve efficiency, impact, and benefit? So here's another thing. Everybody is hearing about price transparency and the fact that now payers are having to publish their contracted rate data out there. Well, we provide that as a service. But more importantly, when you pull that data down, you can find out exactly what all your competitors are getting paid. More importantly, you can also see what your competitors' services are being rendered so that you can be more competitive with your competition. So if you find out your rheumatology practice and you're not exactly doing a lot of infusions, which are very costly, you could possibly find out what your competition is getting paid for those infusions, as well as the drug reimbursement. And then you can start up that service line as well. So there are many things that allow you to be much more competitive nowadays. Price transparency is a huge game changer in healthcare. It is going to change the landscape. How do you think we negotiated those huge rates? You have to know what your competitors are being paid. And now that is a federal law. They have to publish it. But unless you are a genius, you're not going to be able to download that data, and you're certainly not going to be able to manipulate it unless you're a genius like one of my analysts that is an Excel expert, and that guy can slice and dice numbers like it's nobody's business. Are your staff and provider morale? It should be high, otherwise this will affect your patient care. Are you aware of any issues? Do you talk to your patients? Do you talk to your staff? And do you have an open door policy where they feel comfortable coming to you and telling you about their issues? What is the potential for handling more patient capacity? Is there a plan? Do you need more space? Do you need more providers? And then will new service lines add incremental revenue? What are the best ones for your practice? You need to evaluate that and determine. You can really tell from the diagnoses that your patients have, as well as all the maladies that you're caring for and treating. So what's best for your practice? Do you know, like on average, how many patient visits per day per provider? What's your average dollars collected per patient visit? And what are your patient satisfaction ratings? I mean, I've got a PT client that has been doing patient SAT scores for literally 19 years. They rate from one, it's a rating from 1 to 5, and they have a 4.9 rating, and that is from 98% of their surveys. That's almost 100% of their patients rate them a 5. That's incredible. And that helps you achieve huge contract negotiations. So let's talk about human resources. Do you have a full complement of staff, or is it difficult to recruit and retain? Well, that I think is pretty much consistent for everybody nowadays. Do you have an employee handbook? An employee handbook communicates all those dumb little questions that not necessarily dumb, but you may think they're dumb because they take up time, they interrupt your day, and a lot of that stuff can be communicated in a handbook. Why should you have one? Because it makes everything consistent and it documents your policies for you. How do your employees know what their responsibilities are? Again, job descriptions, did they sign them? Do you have all your legal poster requirements up? Because that's a Department of Labor violation if you don't. And you need to know when a state or the federal government updates that information, because you'll need to update those posters. Do you provide training and education to improve your human capital? In my opinion, any practice that doesn't provide CME to all its staff is not a practice that values their human capital. How is the morale of the staff and the providers? You need to know the morale of everybody. What are the issues? How do you learn about them? You got to have an open door. Do you have annual reviews or ongoing reviews? Are you doing reviews? How do your employees know whether they're doing things properly or not? Compensation increases tied to reviews or practice performance. I don't tie compensation increases to reviews. I tie compensation increases to how the business is going. Because if your business isn't doing well, nobody should be getting an increase. Everybody's got to be on the same path to increase the profitability of the practice. So I'm not going to keep going through every single bullet, but here's more information about evaluation for human resources, whether it's position descriptions, performance metrics, analyzing your payroll, a personnel file audit, understanding what your turnover numbers are. How do you interview and retain people? What about your benefits packages? On a compliance evaluation, you have to have a compliance plan. Pretty much everybody does. Are you complying with all Stark, anti-kickback, or self-referral issues? I mean, there are all kinds of regulations that you have to comply with in healthcare. When was the last time all insurance needs were reviewed, evaluated, and shopped? Malpractice, general liability. You've got all E&O insurance. You've got all kinds of insurance. Are you reviewing that and making sure that everything's on the up and up and that you're compliant with everything that needs to be compliant? When was the last time you did a chart review to make sure that your providers are documenting things properly, ensuring that if any payer does review your charts, they're not going to be able to recoup monies simply because you didn't do your job properly? It pays to be proactive. Determine all the compliance areas. You can't just go out and get a compliance plan from your colleague down the street and use that for your practice. It doesn't work that way. And anybody, the OIG, the state attorney general, anybody walking in and auditing you is going to know. If you leave it on a shelf and it's gathering dust, it's not a live, breathing document. What about determining your state escheatment law requirements for patient credit balances? There isn't a state in this country that allows you to retain money that is credited to a patient's account for more than a certain period of time. You have to return that money. And if you can't find the patient, you got to send it to the state treasury, because that's who keeps that money to find who owns it at a later date. A signed assignment of benefit gives you the right to bill and collect on behalf of the patient. They own the claim. Facilities evaluation. Do we have a documented list of maintenance requirements for the building and all the equipment? When was the last time we conducted an evaluation of our vendor services and costs and obtained other quotes? Is there a way to make the patient and workflow more efficient? Do we have a budget for repairs and maintenance? Automatically should, because things break down. And you should re-budget that every year, analyzing what you spent last year, and are you going to need the same amount, less, or more next year? Do you develop safety policies and maintenance programs? Monitor the state of your medical equipment and supplies, perform regular life safety and fire safety assessments, especially if you have facilities like a surgery center, endoscopy center, things of that nature. What are your recommended services and equipment upgrades? Allocate office space based on departmental needs. Okay, don't build an office for a physician that's going to be 12 by 12 when they're not going to produce any revenue from that office. Give them a cubby where they can do their dictation. A lot less space, and you can create more revenue in all the other areas. Ensure that all your buildings meet security standards. Do your staff walk out of the building at night during the winter with no lights on? That's not safe. It's not professional, and you shouldn't jeopardize your safety of your employees that way. Negotiate service agreements with outside suppliers and service providers. I mean, I'm giving you bullets on all these areas you need to check for every single section of your practice. On a financial evaluation, do we regularly have a financial crunch every year? Or do we have a line of credit to lean on, especially at the beginning of the year when we're trying to collect all those copays and deductibles, and a lot of patients don't have it or want to do a payment plan, things like that, you're going to need some cash. Are you monitoring your provider visits to ensure they're producing profits? I say that over and over again because most practices lose money on a lot of providers. When was the last time you reviewed your financials? What about the owners? Do you know your state achievement laws again? I say that often because too many people get in trouble for this. And how often do you review your patient and cash pay patient fee schedules? Did you develop them properly? You should only have 2 fee schedules, one that you bill insurance and one that you give a prompt pay discount to cash paying patients. And a cash pay patient can be a patient that has insurance that chooses not to use it because that's a regulation in HIPAA that they're allowed to take advantage of. And that also means you can never send that date of service, those records, to a payer, ever. You need to document that properly. So here I'm going to give you some financial metrics that you should monitor. And this is just a sample of them. You should use a patient portal used exclusively to communicate with patients to reduce phone calls to the practice. I mean, financial evaluation, we took a massive gastro practice where they had a bank of 9 nurses that took phone calls. Most of the phone calls they were taking were for script refills and for medical record requests. We then made it a requirement that all patients would request scripts and medical records via the portal in writing, and we guaranteed we would respond within 24 hours. Now that practice hardly hears the phone ring. The nurses love it, and it is a very quiet and contained practice. We don't have noise everywhere. Is the financial policy documented for every patient to sign? Remember that AOB I said you need to have signed? That should be at the bottom of your financial statement. Review your monthly financials to include the balance sheet, income statement, accounts receivable, 3-year trends, even maybe your depreciation schedule. So you can see, okay, when are you going to write off the cost of this equipment? When do you need to replace it? Benchmark against valid statistics. There are many statistics out there. The NSCHBC has some. You've got Cotter and Sullivan. You've got the MGMA. Use statistics so you know what your practice should be doing. We can pretty much tell you every specialty, how much revenue every provider should be generating, what each line item expense should be, and so on. Obtain assistance on review of payer contracts and reimbursement. If you're not familiar with a contract language, contract terms, and how reimbursement should be done, then get somebody that is an expert on it to assist you. You will be better off. Yes, you're going to spend a little money, but I'm a big believer of spending money to make money. Do a SWOT analysis. Determine what your strengths, your weaknesses, your opportunities, and your threats are. And you need to be vitally truthful with yourself. If you lie to yourself, you're going to get garbage. Garbage in, garbage out. Everyone is involved to get to the truth. Conduct every 5 years at a minimum because change is constant. Make decisions about the best path for your initiative, your ancillary services, whatever you're trying to do. Determine where change is possible. Change is a good thing. Adjust and refine your plans mid-course. You want to always adapt and be flexible. And all of this SWOT analysis will definitely expose the truth of the present, past, and future if you're honest with yourself. So let's talk about some of the things we reviewed. Why medical practices necessitate a periodic evaluation. Any business should be periodically evaluated so you can make sure that you're on course and on the path that you want to be on. What areas of the practice should be evaluated? I gave you a very good list to start with. Are there benchmarks to compare to? Absolutely. You can find them everywhere. How are those benchmarks determined? You can decide what is best for your practice. I mean, MGMA out there tells you that, you know, AR over 90 days should be less than 15%. If I've got a practice that has AR over 90 days at less than 15%, I'm going to be bitching and complaining because it shouldn't be that high. MGMA lets you be much higher. I want those numbers to be much lower. Actually, I've got practices that have 0 AR over 60 days. That's because they have proactive revenue cycle processes. What should be done with what has been learned from the evaluation? You need to act on it. No different than if you're doing patient SATs. You want to make sure that you're reading them and you act on whatever those recommendations are from patients, especially if it's going to improve your practice for your patients. So with that, I thank you for attending. And if there are any questions, I'm happy to answer them.
Well, thank you, David, for a great presentation. I don't know if everybody else feels like they've been drinking from a fire hose. You have so much knowledge and you go through it very quickly. If anybody reaches out to me, we'll be happy to send you David's PowerPoint presentation so that you can go through it in your own pace. We're also going to be having this video is going to be edited and put up on YouTube in the next couple of weeks, and we will be glad to point you in that direction when the time comes.